I am here to talk about the monoclonal antibodies. You have probably heard some of the news from the governor's announcement, but we want to make sure that you're aware of what's happening in Idaho. Um, the governor would like to see monoclonal antibody infusions increasing in all parts of the state. These drugs are given by IV treatment, so they're not something you can take at home. They're something you need to go into specialized treatment centers, and it's just an added burden for hospitals and providers who are very busy taking care of patients or vaccinating or taking care of patients with non-COVID conditions. So we are trying to work with partners to set up these specialized infusion centers. These antibodies are not a panacea. I'd like to emphasize, and I'll emphasize probably several times in my statements, that the vaccination is the best way to prevent COVID, the best way to prevent hospitalization, the best way to prevent death from COVID is by vaccination. However, it is nice to have one more tool more widely available in Idaho, and that is the purpose of this work that we're doing now. People need to be treated quickly. The sooner the better. And it has to be within 10 days of symptom onset. And we know that a lot of people will let things go for a few days. I think it's just a minor cold or something before they might seek care. Then there's a lag maybe in testing results. And that is a big problem. But one thing the state has committed to do is, as these infusion centers roll out, we will work on ensuring the public is educated, working with the local health department, working with the health facilities that are involved to make sure that we're all working together on this. We will help support messaging to the public and to providers to let them know about this availability, because I think a lot of people, if they realize, hey, there is a treatment that might help me, maybe they'll go in and get tested sooner, and that will be the message: to get tested so you can get treated. The idea with these medications is that people who are at high risk of ending up in the hospital, so these could be people who are 65 and older, people with obesity, diabetes, lung conditions, heart conditions, they can come to one of these as soon as they test positive if they're in one of these high-risk groups, but they don't yet need to be in the hospital. Right now, they're not too sick. They can come in and get an infusion. It takes about an hour plus some observation time, and then they can go home. Many people have reported rapid improvement. And you all may be aware that this was a type of treatment that President Trump received when he had COVID, and more recently, the governor of Texas. So certainly it is availed by people who realize the potential benefit of these medications, and it has been shown in clinical studies to be effective. Like the vaccine, it is under emergency use authorization. It is a new treatment, relatively new treatment. It is still under emergency use authorization, but the clinical studies show that it is very safe, very well tolerated, and that the clinical trials are reporting about a 70% reduction in the risk of getting hospitalized with one of these monoclonal antibody treatments. So I'll say it again. I'm trying to think of a good analogy. I think of it as a seatbelt and an airbag. The vaccine is your seatbelt keeping you in place. Don't feel like your airbag's going to save you. The airbag maybe is that monoclonal antibody once you get in an accident, but you don't want to rely on that. You want to be vaccinated, and that's your best protection. But for people who are not vaccinated, who are at high risk, who might end up in the hospital, the availability of these is going to be a really good option. We're hoping that as early as next week, we might have a monoclonal antibody infusion center opened up in northern Idaho. Details are still being worked out, so more details forthcoming on that.